On Thursday, the United States announced the launch of a new trade investigation targeting Germany. The focus? Germany's pharmaceutical pricing policies and practices. This move could potentially escalate into new tariffs, adding another chapter to the ongoing trade tensions between the two economic powerhouses. U.S. Trade Representative's office is leading this probe, aiming to determine whether Germany's approach to pricing innovative pharmaceutical products is unfair or discriminatory, and if it places undue burdens on U.S. commerce. This investigation marks a significant step in the U.S.'s ongoing efforts to address what it sees as imbalances in global trade, especially in critical sectors like pharmaceuticals. Investigation was launched under Section 301 of the Trade Act of 1974. This legal tool allows the U.S. to respond to foreign trade practices it considers unfair or harmful to American interests. Section 301 has been used in the past to address a variety of trade disputes, including those involving forced labor and industrial overcapacity. By invoking this section, the U.S. signals its willingness to take strong action if it finds that Germany's pharmaceutical pricing policies are indeed unreasonable or discriminatory. This sets the stage for a potentially contentious process between the two nations. At the heart of the investigation is Germany's approach to pricing innovative pharmaceutical products. The U.S. alleges that Germany's policies result in persistent underpayment for these medicines. This, according to American officials, not only limits the revenue of U.S. pharmaceutical companies but also impacts their ability to invest in research and development. The probe will closely examine the mechanisms Germany uses to set these prices and whether they create an uneven playing field for American firms. U.S. Trade Representative's office claims that Germany's pharmaceutical pricing policies are not just unfair, but also discriminatory. The concern is that these practices may specifically disadvantage American pharmaceutical companies, making it harder for them to compete in the German market. Such claims, if substantiated, could justify the imposition of tariffs or other trade remedies under U.S. law. The investigation will gather evidence to determine the validity of these allegations. Key argument from the U.S. side is that reduced revenue from Germany's pricing policies leads to less investment in pharmaceutical research and development. The U.S. notice points out that American companies end up shouldering a disproportionate share of global R&D costs. This, they argue, is unsustainable and could ultimately slow the pace of medical innovation worldwide. The investigation will consider how Germany's policies affect not just profits but the broader landscape of pharmaceutical innovation. Another concern raised by U.S. officials is Germany's plan to fast-track new legislation that would further reduce spending on innovative pharmaceuticals. The U.S. sees this as a move that could exacerbate existing problems, making it even harder for American companies to compete and recoup their investments. The investigation will look closely at these legislative developments and their potential impact on the global pharmaceutical market. President Trump and his administration have emphasized that American patients should not be paying a disproportionate share of the world's pharmaceutical research and development costs. This principle is at the core of the current investigation. The U.S. is seeking a more balanced approach, where costs and benefits are shared more equitably among trading partners. This stance reflects broader concerns about fairness in international trade. The investigation finds Germany's practices to be unreasonable or discriminatory. The U.S. could respond by imposing new tariffs. Tariffs have been a favored tool of the Trump administration in addressing trade disputes. While many tariffs have faced legal challenges, the administration continues to use trade probes as a way to justify and implement new duties. This approach signals a shift from immediate tariffs to more sustained, evidence-based action. Earlier this month, the U.S. Trade Representative's office proposed new tariffs of up to 12.5% on dozens of economies. These proposals were part of a broader investigation into forced labor concerns. The current probe into Germany's pharmaceutical pricing fits into this larger pattern of using tariffs and trade investigations to address a range of economic and ethical issues. Despite the Trump administration's aggressive use of tariffs, many have faced legal challenges. In February, the Supreme Court struck down several of these measures. As a result, the administration has shifted its focus to trade probes and investigations, which can provide a stronger legal foundation for imposing duties. This legal backdrop is crucial to understanding the current strategy. Investigation will proceed with the U.S. Trade Representative's office collecting public comments and holding a hearing in September. This process allows stakeholders, including pharmaceutical companies and patient advocacy groups, to present their views. The evidence gathered will help determine whether Germany's policies warrant a formal U.S. response, such as tariffs or other trade measures. This investigation is not just about Germany and the U.S. Its outcome could have ripple effects across the global pharmaceutical industry. Other countries are watching closely, as any changes in U.S.-German trade relations could influence international pricing standards and market access for innovative medicines. The probe highlights the interconnectedness of global trade and healthcare policy. Pharmaceutical companies, both in the U.S. and abroad, are likely to respond strongly to the investigation. Many argue that fair pricing is essential for sustaining innovation and ensuring access to new treatments. Others worry that escalating trade tensions could disrupt supply chains and increase costs for patients. The coming months will see intense debate as the investigation unfolds. As the investigation moves forward, all eyes will be on the U.S. Trade Representative's office and its findings. The September hearing will be a key moment, providing a platform for all sides to present their arguments. Depending on the outcome, the U.S. could move to impose tariffs or seek other remedies. The process underscores the complexity of balancing trade, innovation, and public health. U.S. investigation into Germany's pharmaceutical pricing is just one example of the broader challenges facing global trade today. As countries grapple with balancing innovation, affordability, and fair competition, disputes like this are likely to continue. The outcome of this probe could set important precedents for how nations address trade and healthcare policy in the years to come.